Good afternoon, everyone. I hope you can all hear me properly and you can also see me. If not, yes, please. Okay, great, excellent. So my name is Evelyn Gitau. I'm the Director for Research Capacity Strengthening here at the African Population and Health Research Center. And today I'm really excited to be moderating a session that is really hopefully, and no pun intended, engaging in terms of how researchers within the Consortium for Advanced Research Training in Africa have worked together to engage policymakers to promote evidence-based decision-making. So while research frequently has fundamental policy implications, it must be effectively communicated to a wide range of non-technical audiences in order to have an impact. This session is one of two sessions that aim to compile lessons that capture contextual best practices in promoting evidence-based decision-making. The discussions will also include how to effectively communicate research to policy audiences in order to elicit action. In particular, the session will be discussing how to communicate scientific evidence to a non-scientific audience from the perspective of the researchers that we have around us in this panel today. So it gives me great pleasure to introduce our four panelists, although I think one is still struggling to join in, and I hope she will join us in a bit. So our first panelist that I will introduce is Dr. Gloria Langat. She is a demographer and gerontologist with over 20 years experience researching population dynamics in sub-Saharan Africa to understand the interplay of context and well-being across the life course. Her broad research topics include aging in developing countries, HIV and AIDS, migration and health, impact of population dynamics on households and families, sexuality in old age and urbanization, and other issues that address long-term care in the aging population on the continent. Gloria is a research scientist at the African Population and Health Research Center and leads the Aging and Development Unit. Our second panelist is Dr. Henry Zakumpa, who is based at Makerere University School of Public Health. Henry holds a PhD in Health Policy and Systems Research, and in early 2017 was a Carnegie Corporation of New York Fellow at Michigan State University. He's a two-time fellow of the DoD at the University of Kassel and University of Oldenburg, and he has been principal and co-investigator on research projects funded by the Gates Foundation, USAID, WHO, Wellcome Trust UK, and the Pop Council. Henry has established extensive research and a body of evidence around work that has differentiated HIV service delivery in esteemed international journals such as Implementation Science, Global Health Action, etc. And he has been part of the CARTA family for a long time. Our third panelist is Dr. John Ayodele Alonga from the University of Ibadan, Nigeria. Ayodele is a lecturer and librarian at the University of Ibadan and has deep interest in emerging technologies in libraries, archive and record centers, health information systems, and health and communication, publishing studies, and new media. During the COVID lockdown, Dr. Alonga led a social science research project to study the experiences of researchers in COVID-19 lockdown in Africa. He is a CARTA graduate and we're very excited. While we wait for our fourth panelist to join, I will introduce her. Her name is Professor Violet Nanyu, who is an associate professor in the School of Arts and Social Sciences, Moi University in Kenya. She's also a visiting associate professor at Aga Khan University, Nairobi, and a senior social scientist at the AMPATH program in Eldoret, Kenya. She serves as a co-director of research in Indiana University Kenya program and has been a founder of the AMPATH Qualitative Research Core and a member of Africa Ethics Working Group, a member of the National Bioethics Committee in Kenya, and a co-chair of Indigenous Populations Working Group, Global Alliance for Chronic Disease. Professor Nanyu's training is in medical sociology, medical anthropology, and global bioethics, and her research focus has been on understanding, evaluating, and addressing individual, structural, and social cultural factors affecting illness and health. She is particularly interested in global bioethics and collaborative valuations, and has spent a lot of time training others to develop policy communication that is effective. So I really welcome our panelists and hope that they will share their experiences and what they've learned in their research career as they try to disseminate their results and engage with the wider public in general and decision makers in particular. As we go into our please, if you have any questions, please put them in the question and answer panel rather than the chat question. And we will, and hopefully you will engage with us over the period, and I will try to direct the questions as well as answer some of the questions as they come along. So the first round of questions to the panelists will go perhaps to a few of us, and then maybe we'll come back to the audience. So I'll start with Gloria. So you have a vast experience in engaging policymakers in health, migration, and population dynamics in multiple countries in Africa. Could you share with us some of the challenges you have faced while communicating with policy actors in Africa? And secondly, what are the strategies that you found helpful to try communicate your research work effectively?
Thank you very much, Evelyn, for the introduction. I think I'll first begin by talking about the strategies and then go to the challenges. So I'll be drawing on my experience from the last 7 to 8 years, where I've been focusing on the gerontology and particularly trying to understand aging within the African context. So these 7 to 8 years span from the time when I started my postdoc with the British Academy and all through to the point to currently where I'm a research scientist, including my time at the University of Southampton, where I was an associate professor in gerontology. So when I started off in my early career, or when I was doing my postdoc, communicating to policy wasn't really a very stressed upon activity. But over the years, I've seen a transition where funders who fund research have begun to pressure researchers to communicate and to engage with policymakers who are the consumers of research. I've also seen a transition in even within the policy landscape in Africa, where previously policymakers were not keen on using evidence to inform policy, but over time, because of the changes in the policy landscape in Africa, where they are now beginning to own the policies to take more responsibility, there is an increasing now demand for evidence in order to support the policy that is happening in the Africa continent. So my strategies have also been quite dynamic. So I'll start with what I did previously and then move on to what I've done currently in terms of strategy. So my previous engagement with policy started with just having a passive support from policymakers, for instance, where they provided support by giving a letter of support when applying for grants. And at that point, that was just sufficient. And we'll now go back to the policymakers at the time of dissemination. We invite them over, we present our findings, we produce policy briefs and disseminate that. But from what I learned from that experience was that there wasn't really any ownership in the results findings. People would come and attend a one-day meeting, but there wasn't really any ownership or any engagement which was meaningful in that just one-day meeting. So the next strategy that we adopted now was to co-produce, so the co-production of knowledge with policymakers. So this is from the inception stage where we go to the policymakers and ask them, okay, we have this research idea. How do you want to? What are your interests? How would you want these questions to be modified? What would you be interested in to be added to this concept? So from the concept stage, we started engaging with the policymakers so that they have ownership and they also have an understanding of what to expect from the research. So we realized that by involving them in the so this was co-production, there was now more acceptance and even eagerness now to get the results from the research. So co-production became quite a useful strategy in ensuring that when the results come out, the people in the policy arena would use that evidence to inform their policy. So the other strategy that was also very important is just to keep the people who are the policymakers and the activists informed of all the steps that you're taking. So when the grant comes through, we write a letter to inform them of what is happening, so that they don't also feel that you're lost. Because we used to get, in fact, there was one person from Ministry of Health who came back and said, we write so many letters of support, but we never get any response back. We don't know what happens. So keeping the policymakers in the loop of what is happening was one very good strategy. So building relationship. So this was also another strategy, building relationship with the policymakers and all the actors in the field, and understanding that it's really a mutual relationship between the researchers and also the policymakers. So not just involving them at the time of research, even outside of the research, inviting them to trainings, building their capacity as well, was something that we realized was so that we get mutual support. We engage with them with policy, but we also provide them with further capacity building within their institutions. So this was now at the local level or at the country level. So the strategy that we used to reach policymakers at the global level was to partner with other projects that were working on similar areas, because we realized that your study, like our study, was just covering a very small population. So how do you go with that, maybe a sample of 300 people, to go and talk to the AU or to talk to the UN? So it worked well to partner with other organizations in Africa who are working in similar areas, and produced a report or a policy brief that gave now a sort of Africa-wide perspective on the topic. And this had more voice, and also it could be used now in different platforms. So we saw that it provided a synergy where you're sort of talking, it's the same voice, but it gives more credibility when you have you can't just rely on the one study that you've done, but by collaborating with other researchers in the continent and who are working in the same area, it was one way of reaching and having an impact at the regional and even at the global level. So in terms of challenges, there are of course so many challenges, but the one that comes to mind, and that is quite a big challenge, I think, for all researchers, is the policy circle, the research circle, because it takes up to almost 2 years from the time you start your concept to the time you collect the data. So for instance, in one of the most recent research we did, we contacted the ministry, say in 2014, but then the grant came through towards the end of 2017. So almost 2 years later, we now have the data. And by the time the results were out, actually the policy had shifted in the ministry. They had moved on to something completely different. And the other thing that was also a challenge is the reconfiguration of ministries. So the people you are working with at the start of the project, by the end of it, people have shifted. Maybe the department you're working with has been dissolved. It's been absorbed by another larger ministry. So that is I think is a constant challenge that probably needs more thinking through in terms of how we plan our research to be in line with the government circles of work. So research can take up to 3 years for you to get the results, but the ministry would want, or the policymakers would want the results now. So how do we reconcile those two, between the urgency of the demand for that output, for the results. But then researchers, you want to follow the normal research process, which can take up to 2 to 3 years. So I would stop there and then maybe give a chance to the other panelists. Thank you.
Okay, thank you, Gloria. That's really great. I mean, you brought out some early strategies, which I'm sure will be enhanced by our colleagues: co-production, keeping them informed, building relationships, and when you're not using the same strategies when you're working with local partners vis-a-vis global partners. I'm interested in the challenges because you talk about the research cycle in comparison to the policy window. The policy window where when you present the research, it is timely because the ministry understands it at that time. But then actually by the time the research cycle has come to an end, maybe you've got different teams, you've got different priorities because it takes longer than the current policy window. So those are things maybe we'll be able to unpack in terms of how do you capitalize on the policy window. But for now, I'll move on to our next panelist, and I want to welcome her because she wasn't there at the beginning. I don't know, Violet, if you'd be able to turn on your video. We had introduced you before, but I'll ask you the questions, especially in relation to some of the things that Gloria has mentioned. You know, we talk about a policy window, but the word policy often makes us think of images of very high level officials. Parliament, which we know, of course, in many of our countries is a 5-year cycle. The president or the prime minister, we think about official documents. I mean, policy can be all that, but it can also be many other things. And really, research is critical to informing all of it, although sometimes you don't need to make policies out of research. Could you share with us an example of your engagement with policymakers in Kenya? And then also mention a couple of things related to research ethics, because you have worked a lot with ethics in Kenya. Can you share your experiences in that area, how you've interacted with other researchers and policymakers to strengthen research review processes and institutions in the country? Welcome, Violet.
Thank you very much. Can you hear me?
Yes, we can. Yes, we can, Violet.
Thank you very much. And I'm sorry, I had a technical hitch trying to connect, and I'm very glad to be here. It's always a pleasure to be at CARTA and at APHRC. I'll start building off what my colleague just talked about her experience by sharing a way that has worked for us. So it's good. I picked on 2 of my projects, and I think the first one will directly answer one of the questions she has raised. So I'm going to tell you about some work I have been doing around non-communicable diseases, and we are a multidisciplinary team, and the first member is the Ministry of Health. So the first project is titled Primary Integrated Care for 4 Chronic Diseases, and this particular project is a pilot, and it includes breast cancer, cervical cancer, diabetes, and hypertension, and it's a pilot by the Ministry of Health in partnership with the World Bank and Access Accelerated. And here the idea is to try and integrate care for non-communicable diseases at the primary healthcare level. And this was tried, the pilot was tried in 2 counties in Kenya, the Busia in the border and Trans Nzoia counties. And the overall goal of this effort was to improve access and coverage of NCD services in the 2 counties while collecting information and evidence that could inform the Ministry of Health to scale up that primary healthcare approach to NCDs across the country. And part of it was to check, what is the cost, what are the implementation strategies working, what are the lessons coming home. Now, the key players in this project include even the Moi Teaching and National Referral Hospital, the 2 counties, the MOH system there, and the national government. So they were part of the program from the word go, from the design, part of the implementation and the dissemination. And just to highlight that each of these parties, these key stakeholders, made a commitment and signed an MOU. And just to highlight the Ministry of Health commitment, they said, we're going to provide all the policy frameworks needed for this NCD work at primary healthcare level and how we can scale it. We are going to convene learning platforms through which dissemination of the results, every quarter you can disseminate your findings and you can share your process evaluation. And so we've been doing this routinely. Then they said, we are going to support M&E to make sure we gather everything we can from this pilot. And lastly, they said, as you give us whatever you find out, we want to use it to inform what is called the Kenya Non-Communicable Disease Strategic Plan, which goes up to 2026. So they're literally taking, by the way, we've just closed the project, but we have a no-cost extension just to tie loose ends and write papers. They're literally already using the findings from that study to inform this strategic plan that goes up to 2026. Allow me to share briefly a second one. This one, I'm part of a team, again, on non-communicable disease, but particularly cardiovascular disease. We are a team that's doing an evaluation of guidelines being disseminated to improve care for cardiovascular patients in our country. So these guidelines were developed very closely with support from the World Heart Federation, involving at the heart of it, the Kenya Cardiac Society, and of course, the Ministry of Health. Then they said, oh, we're rolling out the guidelines. We want an evaluation at baseline and end line to see whether these guidelines are going to make a change and are going to help with things that we are doing. So the purpose of the project is to check for effectiveness, efficiency, relevance, sustainability, lessons learned, and the best practices they have learned in implementing this before they spread it all over the country. So these two examples are all touching on non-communicable diseases, but I thought I would show how the team I'm working with out of Ampath and Moi Teaching Referral Hospital has been engaging the main consumer from the word go. And I think instead of saying, let me finish my project, and then I'll come and share my findings, and hopefully I'll inform policy at that point, if there's a way earlier on, you can identify, it doesn't have to be an officer, let it be an office. Like she said, sometimes the officer changes. And like in Kenya, this is so common. You start with Mary, in 2 years, it's John. By the time you're finishing your project, it's Kamau, you know? So that's what I thought I would mention. Do you want me to go straight to research or with something else? Then I'll talk about the research.
In terms of the research ethics, maybe what we can do, we can pick it up after this round.
Yes.
But I really like where you've taken us, because it contrasts a little bit, I think, how Gloria brought out the aspect of co-design and collaboration. You know, Gloria mentioned things like support letters, informing them, dissemination, but you've talked about maybe a bit more of the engagement in terms of the design and implementation. So when you say every quarter you would give them the reports, but actually they were part of the M&E ETC. That's a slightly different engagement that perhaps we may contrast in terms of how some of us have engaged with the policymakers. We ask for their support letters, we then ask them for their priorities, we co-create the proposal, but then implementation means that we come back to them with the results at the end, not necessarily every month, every 2 months. Of course, not all research speaks to research that can be disseminated every quarter. But those are points I just wanted to pick out and contrast even as we go ahead. So now I'll move to Henry. Your work revolves around differentiated HIV service delivery. So maybe you could share with us your experiences on the need to use a different communication style when addressing an audience of researchers versus the general public or policymakers, because of course one of the challenges as researchers is how we speak. You could tell how Violet was communicating was slightly different from how Gloria was communicating because of her expertise in communication. And I don't know if you're picking out, maybe Henry, you can talk to us about that, and then talk to us about an opportunity you've presented your work to research to a policymaker or the community and how you approached it. Henry, you're on mute.
Sorry, I said thank you very much, Evelyn, for summarizing and really rapporteuring our discussion this afternoon. So I actually have some things to share with colleagues today, because based on an actual project which was supported by CARTA, it was a re-entry grant I had, and I was looking at ways of scaling up innovations in HIV service delivery called differentiated service delivery. So these are kind of new approaches, because the old approaches of HIV service delivery were very like a one-size-fits-all approach. Monthly visits for reviews, you're seen by a clinician, and you have to go to the facility. But these innovations entailed, if patients are stable, then you can extend their appointments. They can come even once in 6 months. They can get their drugs in the community. They can form groups, and members can pick drugs on their behalf. So as you can see, these innovations required a lot of revolution in the health system. So it needed a lot of policy change, health systems adaptation. So this was an exciting project because we had to engage with the health workers, with the policymakers, because to bring these innovations to scale from the evidence, because the evidence had shown that actually these innovations lead to better patient outcomes actually, compared to traditional HIV approaches. So now this was an exciting time after I finished my PhD, and the World Health Organization had said, let's go ahead with differentiated service delivery. Let's reduce on patient burden of going to clinics every month. Let us reduce on congestion at the clinics, health worker workloads, let's reduce them. So these were exciting things, and research had shown that they actually work, and they result in better patient satisfaction, of course, even health worker satisfaction. But now moving from the evidence into policy, the uptake, and in health system adoption, those were again where the challenge is coming. But just to answer your question right away, is that after I collected data and tried to, of course, report to the policymakers, the and even the health workers, I found that the language we use as researchers, really, there has to be a change. You know, as a researcher, you are trained to communicate as a scientist. You know, for 4 years, you're trained to write an abstract, to write a manuscript, to write a book chapter. So you find that you are kind of unprepared in terms of the language spoken by policymakers or a district health official or a nurse at a health facility deep in northern Uganda. So because actually there's a nice quote, somebody said that researchers are from Mars and policymakers are from Venus, you know. It shows you how the language spoken is really quite, I mean, we try to communicate to scientists, and policymakers do not speak the way we speak, you know, and we really have to retool ourselves to re-engineer our language, our communication skills. Yeah, but just to give you just some few points I found is that, one, you need to speak in an accessible language, simple language. You have to lose all this jargon, this scientific variables and all these coefficients and Kaplan-Meier, so you have to really find a way of communicating to an audience, you know, because the policymakers really range from an MP, a member of parliament, to a district chairman. In Uganda, district chairman, or in Kenya, what they call a county chairperson or governor, maybe somebody with secondary school education at best, you know. So you really have to know how to tailor your message to the policymaker in a way that's accessible. So you have to speak in a conversational, popular, accessible language, you know. Like if you have picked up a newspaper, you have seen the way journalists write, or even opinion letters to the editor, you know. You speak in really simple English, you know. Chinua Achebe used to call it is and was English. I read a novel in O-level called No Longer at Ease by Chinua Achebe, and was called the is and was English. I mean, language that's accessible to the wananchi, to the populace, to the common man. So you have to lose the jargon, and you really have to find a way that you are communicating and you're building rapport and you are being understood by the policymaker. So that in a way, of course, as I said, you need to retool. You know, you need to move from being a PhD or a researcher to being someone communicating to people who need to understand your message, and you really have to break it down in a way that is really understandable. But also what I discovered from engaging with policymakers is that they want, although we are used to this IMRAD structure of introduction, methodology, results, the approach is quite different, you know. First of all, I found they are more action-oriented. They want you to have main points, you know. Okay, you say, Henry, you did this research. Tell us, what are the 5 takeaways, the 5 key messages from your research, you know? So for you have come with 15 slides of methodology and, you know, conclusion and discussion and those kinds of things. So these people are more action-oriented. They want you to tell us, okay, you have found a problem, Henry. What do we need to do? You know, do we need to change the policy? Do we need to change the HIV guidelines? Do we need to strengthen the capacity of our medicine supply system so that we can able to provide drugs for a longer period of time? So you see that they speak a language of action, you know, of being pragmatic. In research, we have more, we have been trained to be more, more methodical in our approach and be more unambiguous, try and give limitations of our studies. But these people want you to give them actionable points, main points, And also I found that they like visuals a lot, graphic representation of data. So instead of having text-heavy PowerPoint presentations or talking in a very, communicating a lot of information, they really want you to break it down for them in a way that they can visualize the data in a very easy way, So instead of having a text-heavy slide, or they want you to really come up with, an image that really summarizes the data in a very simple, easy to follow way. So I found that you really have to learn, you have to acquire this skill to engage with policymakers. And also what I found is that they have competing, a lot of competing priorities of their time. They're always on the smartphones. You can have, this time I had a meeting, I had the minister invited for my presentation, and the minister came. He was supposed to attend for 1 hour, and within 20 minutes he has to go. He has to say, Henry, I have to meet some delegates, from the WHO, So you see, if you have prepared a PowerPoint presentation where you're going to give your main findings and recommendations at the end of the presentation, you're going to miss the minister. See, so in a way, you have to find a way of communicating the most important things at the beginning, of your presentation. So you can see it requires you to re-engineer the way you work as a researcher. Okay. So and then I think also everyone asked me what have I learned from engaging with policymakers and from patients? I found that, again, when you deal with patients, because I work a lot with patients as well, because these HIV delivery models are aimed to ease the burden of treatment on patients. And there are differences, again, in terms of categories of stakeholders. Policymakers have some nuances in the way you handle them, and patients are different. I found, for example, that patients, first of all, have a lot more time compared to policymakers, So when you organize a workshop, a seminar, a training, they really want to engage you even beyond the time you have available. I organized one in Fort Portal in Western Uganda, and the patients didn't want to leave, and they brought up all the problems they have, these new drugs which are bringing side effects, and they need income generation projects. So you see that they have more time, and they also, number two, they have a lot of expectation of the research. They think that when you come with these results, then it will automatically translate into policy, into changing of guidelines, into Ministry of Health listening to you, of course. So they're very expectant of what research can do, and of course that there are limitations. Then I found that with patients, you have to use local language as well. English, if you go to many of the patients in Uganda, many of them, not very many learn English language. So you have to either go with an interpreter, someone who can speak the local language where you're going, So it's always a good idea to go with one, because you may get barriers in communicating if you only go ready to speak in English. And then also I found you need to have creative ways of engaging these communities, We're used to this lecturer mode, this PowerPoint presentation and then question. Now, when you're dealing with the patient community, you have to alter the mode different, And we because of the way we are trained in school, we are normally have this lecturer-led discourse, You are the one with the knowledge, the evidence, you are dispensing it, and people are there to just receive, And I found that actually our participants, our community members, have a lot to share, and people have been talking about co-creating. Actually, I found patients are very intelligent people with exciting, innovative ideas, So this idea of you coming to tell them how it is, I think you will be surprised, because you engage them and you find they are coming up with fantastic ideas. So you have to find a way how do you engage them. You are going to do like a community hall, Sometimes I begin by just giving a couple of slides, and we get into an interactive session. And instead of me really just, speaking to them as they say, So you have to find a community. You're gonna have community barazas, You sit in the middle and they do like a semicircle around you. So you really have to find a creative way of engaging them, And then also I found that when you are engaging with the community, there are people who are vocal. In every group, you find those who speak a lot. Sometimes they dominate the space, and that's not healthy for you, of course. Because and then you find some people who are more silent, more not very oral and very communicative. But what I found that you have to find a way of engaging them. And I found actually those people keep quiet are not necessarily dumb. Some of them actually have exciting ideas, actually. So one thing I also found is not to allow some key individuals in the group to dominate the discourse, to try and engage as much as possible everybody else, And then also something I learned is about community entry mobilizer. You have to get a community entry mobilizer, somebody in the community to help you to navigate entry into the community. Because if you're going to a district in Uganda, they will always ask you where the letters, who has authorized you to do this? Do you have permission from the National Council of Science? Do you have permission from the Ministry of Health? So it's always good to have what we call community entry mobilizers, you get someone who can help you navigate all these processes of entry, even engaging someone in the community you're going to engage with ahead of time. It can help you set up these meetings and talk to the community leaders so that when you really get to start your community engagement, you have buy-in from everybody, you have cooperation from everybody. So that's something also that I thought I learned from engaging on my CARTA reentry grant project. Then also something that I found from engaging with the community, especially patients, is that they always have this feeling of follow-up. As researcher, you think you're going to do this community engagement training and you are done and it's over and you're done, But the patients want you to continue. They even send you messages after, 1 week after. Henry, you told us about this. What's happening? Have you talked to the minister? Have they changed the guidelines? So for them, this is real. It's not academic. It's not a project. It's for them. They really engage with action. As I said from the beginning, theirs is action oriented. It's not academic. It's not abstract. It's real life. They really have expectation. So you really have to be a community advocate, a CSO activist, somebody who's not just an academician, but someone also who wants social impact, wants transformation in the community. Yeah, so I think those are some of the things I learned about the differences in stakeholders, the policymakers and the communities and the health workers that I thought I would share. Well, I will later on share more from as we get into the discussion. Thank you very much, Evelyn. Thank you.
Mm-hmm. Thank you, Henry. You've brought out a couple of things, and as you were speaking, I was being the facilitator that I am. I was trying to pick up whether you were practicing what you preach in some of the things that we do as researchers. You say when we talk about variables, and I'm like, can we teach ourselves not to say variables when we're talking to people, non-researchers? We assume everyone knows what an abstract is. You brought out that's just some humor, but you brought out some interesting aspects around participants and how they want to be engaged. And when you do participatory research, it is almost an obligation, and also very easy to feedback to the participants. But sometimes others who don't actually engage with the participants as part of the research may sometimes forget to come back to the patients to disseminate, or even dissemination is, this is what we found, rather than this is the impact it is on you. So maybe as I want Violet to take that note on our ethical obligations in effectively communicating some of the things, and whether as researchers we could do better, or where and how we could do better, because I think that is a challenge. It is something policymakers keep throwing back at us. But all three of you have mentioned the word co-creation. And it's interesting. I had a conversation earlier today about someone saying genuinely co-creating. So as we go along, I want us to think about what genuinely co-creating means, because I think we all use the jargon word co-create to imply that actually we're doing what needs to be done in terms of engagement. But sometimes we may need to unpack that word, just as much as we said we need to talk in simple language, so that people know the different levels of co-creation and what is effective, what has worked in terms of co-creation, and what do we mean when we say co-creation. But now I want to move to John. You're a librarian with interest in emerging technologies, and communication gives you firsthand interest in this area. Last week, you shared with us how active you are on Twitter and even on YouTube. trying to put your findings out there in a way that is easy to understand and is actually easily accessible. Because I think one of the criticisms we get is we publish for the journals. I've had policymakers say, if it's not a big journal like Lancet, we're not interested in talking to them. Have those outlets been useful for policy engagement? The YouTube, Twitter. And what do you think are the advantages and limitations of social media for this purpose? And then secondly, do you think there's value in engaging more traditional media such as newspapers or radio? And how useful can these be in engaging policymakers? And how often, I think beyond Twitter, we assume social media is quick action. But in these other main media, how often should we be engaging participants, and why should we do it? Over to you, John. Thank you.
Thank you very much. I appreciate the CARTA and the APHRC for inviting me again to speak on my experience, in this regard, using new media. I'll call it new media, in disseminating information. I will also try to explain this from my research perspective. When I was doing my PhD research was the use of social media for health information communication. I focused on using social media to communicate HIV and AIDS information to young people. And during this period, I discovered a lot of things that young people, they don't really go to traditional media. When we say traditional media, we talk about the newspapers, we talk about the billboard, and so on. That the young people consume information mostly on the new media, especially on social media. So as a result, any policy, and even the policymakers also, because of the easy to use of this new media, they tend to get information quickly on this media. So a researcher or any researcher that doesn't take this medium as an important medium, they will not get value for whatever they do. Because the advantage or the joy of having research is that you conduct a research and the outcome is being felt, in the people that you are writing that thing for. So as a result, I would say that social media, talking about YouTube, Twitter, Facebook, they are a potent way of reaching out to the policymakers. Because, policymakers, as you see them, maybe the researchers, the people in government, they are in different levels. First place they will go, because of the easy to use, is their mobile phone. So any information that is trending, for example, you have an idea, or maybe the outcome of your research, and you make it available online, or you organize a discussion like webinar, or maybe a Twitter space, like what that was done. That was one that was done about the teenagers going for the family planning in Nairobi, in Kenya. I was engaged in that. I listened to them. So you can see, if these discussions are not brought into the new media, it may not be heard by the general public. Because let me ask you, when last did you get newspaper, in terms of hard copy and read? When last did you even go to look at the billboard? Your billboard is your Twitter, is your WhatsApp. This information gets there first before you can go out and see it on the billboard. So the policymakers, they are engaging, or they are available on the new media, on the social media platforms. So if you want to engage, if you want your ideas or the outcome of your research to be heard and to be used, I will advise that you make use of new media. You engage the communicators that can help you to rewrite your work in such a way that it can be seen online. That is one. I will say that is not the end of the whole thing. Because if you say that you are engaging on social media, there are some policymakers or some people that will receive the outcome of your research that they are not available on new media. So traditional medium or traditional media platforms, they are still very available and they're still very important. For example, now, if you are talking about the local community, the local government and so on, and you say, oh, everything should only be on the new media, you know, you will be losing that, that population. The people on that, on the local community, they will not be able to get what you are saying. So you must be able to be dynamic in the use of the media in communicating issues on health. You know, use both. You need to understand your community. Who is your community? Who is receiving your message? Are they the people in the local governments? Are they the people in the rural area? So if you do that, you'll be able to now use all those mediums together in communicating your ideas to them. That's one. And again, I will also say that if you want to engage the policymakers, you need to associate with them. You need to associate with them. You know, it means that it's not only when your research is done, you know, that is when you engage them. You need to engage the policymakers right from the beginning. I will give you an example. When I was doing my PhD was done in Nairobi and it's on health information in Nigeria. I had to come back to Nigeria to get letters from NACA. NACA is the body in charge of HIV and AIDS in Nigeria. I had to get letters from the Ministry of Health. Not only letters from them, I get involved that I need somebody that can work with me because the outcome of my work will go to them later. So I was given people, representative, which I'm sending my work, the proposal to them, how the work is good, I was carrying them along. So when the work is done, when I was doing my dissemination, I was able, the outcome of my work was accepted because they were carried along from the beginning. And not only that, because also I had interest, which I'm still having interest in what is happening. Like, for example, now we have some international health days, like International HIV and AIDS Day, which is every 1st December of the year. Even before I completed my PhD, I was organizing programs on this day. You know, International Disability Days, I organized programs involving WHO, involving the health, Ministry of Health in my country, involving the Ministry of Education. So with that, because they know that this guy has been working, promoting health information. So whenever I call them, you know, for dissemination, or I call them to look at my documents, they easily come because I use all the medium. I have interest in what they are doing. And also, though I would say that social media is the most important now in communicating health research, I didn't look at that alone. I also make use of newspapers, you know, traditional ways, because there's some population or some target population that they are not on social media. So in conclusion, I would say that all the medium are very, very important, both the new media and also the traditional media. So you just need to understand your community base. You need to understand who is the recipient of the message that is coming out from your work. And also you need to understand where are your policymakers. Thank you very much.
Sorry about that. I was having challenges unmuting. Thank you, John, for that. As you were speaking, I think one of the things that struck me, and I meant to mention it before, even as I go, there are a couple of questions in the chat that we would pick up now, is majority of us in this team have talked about policymakers, but then I wanted us to challenge ourselves and think about the fact that perhaps because we are saying engaging policymakers, is the question of, is policy engagement only limited to policymakers? Maybe we should challenge our own defaults. That's why the title of this discussion was policymakers, but it could be that actually that's not how you achieve policy making only. But you brought out the issues around new media, old media, access, different audiences. And I was speaking from a point of perspective, the numbers. Henry talked about patience. And I was asking myself, okay, we can reach some policymakers, some participants, some patients on new media, but we need to be aware that actually we need to have some community engagement that allows us to engage in other different sources of media, the radio that may reach others. We need to be cognizant of the fact that actually the percentage of people on social media on the continent is still very small. And are we actually getting to the audience that we need to seek? So I'm going to start with some questions and then come back perhaps to Violet, who can talk to us about some of the research. I know, and I'll pick up a couple of questions so that we can then address a few of them. Florence had talked about different models of engagement. I'm looking for her question. It would be good if you put them in the chat so that we're able to follow them easier rather than me having to go through the chat in the question and answer questions. But Florence is talking about theories, models, or frameworks, and what types of models have you used? Maybe you can come back when you're responding and enhancing some of your questions, whether there are specific theories that you use. Kikelemo is asking about, is the policy landscape in Africa monolithic? Can it be really one size fit all? And I think maybe that's related to Florence's question around models and frameworks. Are there some specific frameworks? I think Gloria talked about, it was Gloria as well as talked about working and how you engage at the global level, at AU level, and at national level. And are there different models that work better? And then Janine has talked about co-creation is an approach that is feasible, but it depends on the value embedded by the researchers and other stakeholders involved. What is the shared agenda? So I'm just going to stop there and maybe perhaps I'll go back to Violet, because maybe you can tell us, even as you come in to talk about the research, are there specific models that work for specific audiences? And because Africa is not monolithic, how do we address the differences? As a research organization, we may say we have a communications, we have a policy engagement strategy. Is it actually realistic to say we have a strategy that works across, or what do we need to think about in these types of things? So Violet, I'll come back to you on that one. Thank you.
Thank you very much. I appreciate my colleagues and what they've shared. Thanks, Henry and John, for sharing your own experiences and also from your earlier work through CARTA. I think my quick answer is no, we don't have, and in fact, this has been illustrated already by Henry and John. You cannot use one strategy. The audience matters, the content matters, and the political climate matters. So you can't just say, this is how we'll be using a baraza, for example, and this is how it will be run. We will meet in as a social hall. We will have PowerPoint slides, and you can't use a space. You can't, I would say there's no, no model that fits. First of all, Africa is diverse. Then the example I gave was from non-communicable diseases. I'll give you an example. This Tuesday, we were in a place called Kilifi in Mombasa, and we are working on mental health among adolescent girls who've had babies. So young mothers, very young mothers. It's a project with collaborators from Aga Khan University in Kenya and collaborators from the UK. The idea is that a lot of girls are dealing with a lot of mental health, depression and other things going on. They're very young, they're mothers, and an intervention is overdue. So what did we do? We went first, used qualitative research methods, and just engaged the girls. We had photo voice, we had spiral walks. We walked with the girls through the village, and we asked them, walkers, in your neighborhood, tell us what any neighborhood space means to you. It was very qualitative, very engaging. Then we had focus group discussions with them, and we selected a few for in-depth interviews. Tell us about the last pregnancy. Is the father involved with the child? How have you dealt with it? Have you gone back to school? It was very one-on-one and deep. Then do you know what we are doing now? We are holding 4 workshops. So during this, the first workshop was with the girls only. the girls and what we're calling young women. And we told them, we're calling you back to tell you what we found out from the spiral walks, from the focus group discussions, and from the in-depth interviews. And we discussed with them, we put everything on walls and on tables, and we asked them to talk about it. And then we had vignettes. We had a vignette describing a girl, and we developed the vignette using the data from the formative work to describe a girl's life. Then we asked them, what should she do? Who should help her? Where should she go in Kilifi? Oh my goodness, I wish I brought the pictures. We asked them to even draw. So they would draw how, then we asked them, okay, if you want to use a picture, draw how she looks like right now. Then we asked them, now on this other chart, draw how she would look if she got all the interventions you think she needs. And they drew the girls with lipstick and earrings and smiling. And in the first one, a totally different picture. You can say this is a very rural community, and the research team felt like, let's do something different. So by the way, now Tuesday was workshop 2. In workshop 2, we brought other stakeholders. We put them all in one social hall, but we put a desk for the girls. We put a desk for the healthcare providers that the girls go to, whether it's for sex education, for family planning materials and counseling, where they go when they're pregnant, during ANC, for postnatal care. We put the providers there, and then we had a section for spouses and for close family. Guess what happened on Tuesday evening at 4 o'clock when we're about to close? Okay, there are many steps in the workshop, but towards the end, after the group work, we asked them to get a person to share their findings from the discussion and share them during the panel. So at some point, it became, I've seen someone, Mwaniki, asking about hostility and unfriendliness. At the end, the girl who was presenting was very vocal, and she was like, you know what? It's good these nurses are here. We want to tell you what we think. And they really became, they were so expressive. And then, all the girls now were even reacting, saying, it's true. It happened to me. It happened to my sister. And the healthcare providers were there. They're supposed to be part of the big portion of policymakers. They're the people actually implementing policies that come through the MOH system, whether it's patient flow in the facility, guidelines for healthcare delivery, you name it, they were there. And it became, we had to moderate now between this supposedly client, and the provider to the client. And this is a research event. We've come to give back, but also to say, let's discuss what we have found out and have these workshops, a series of them, there are 4 of them, we have 2 more to go, and discuss the way forward. How are we going to deal with this issue, the Kilifi way? How are we going to deal with this issue? Having in mind the audience is this young adolescent. So I probably I'm not giving you the answer you need. I just remembered that when I saw that on the chart, but also thinking about, it's the first time I'm doing this kind of dissemination on the go and co-creating and, real stakeholder engagement, in unpacking what the findings mean and how they should be interpreted for a very specific context. Evelyn, I'm very infamous for getting off the track. What do you want me to talk about now?
So that's fine. I think you've responded to some of the areas that and we'll come back, because I think the hostility issue, that's from a participant point of view, but that was maybe targeting someone, where they're receiving the healthcare from. But I believe someone, Moniki, was actually talking about policymakers and hostility. I don't know how many of you have ever been on a panel where you're discussing research evidence, and then the policymaker you're hoping to charm into thinking that this is great, we can adopt some of these things, tells you it is nonsense. You guys do not know the realities on the ground. You know how they speak, those types of things, and whether that's an experience. But perhaps maybe we can look at, as we're addressing that issue, Janine had a question around impact on policy and social impact and change at community level. As Africans, we know that evidence-based policy making alone is not sufficient to see the change on the ground. So how do we close the gap? Maybe, I don't know if, Henry, have you thought about this evidence-based policy making alone is not sufficient? How do we close the gap? I mean, implementation of policies, have we gotten to that point?
Thank you, Evelyn. That's right, actually. And I think we should not be under any illusions that moving from evidence to policy is a linear path and our evidence will be taken up very quickly. And actually, the truth is, first of all, there is competing evidence, actually. I used to work in tobacco control, and there's a lot of evidence showing that when people smoke, it leads to lung cancer, it leads to heart disease, and those kind of things. And because the tobacco industry also generates billions of dollars from selling cigarettes, they would hire researchers, to go and do studies with the contrary evidence. So first of all, when you come with these super p-values and all those things, and you're presenting before a minister, a commissioner in the ministry, a district local government, be aware that sometimes there is contrary evidence what you're saying, actually, and there are many cases. There were many, even within COVID-19. I remember, for example, the idea of a lockdown in Africa was contested. Recently I was in Sweden, and the Swedish did not agree with the lockdown measures. You close schools, you ban public transport, and these kind of measures. They were actually not implemented in Sweden. And they were eager to hear from me from Uganda, who was following the template from WHO of lockdown and epidemiological control. And so you see, if you are, for example, a minister, you may get two converging opinions on a matter from academicians, even from the same institution. You could have somebody from University of Nairobi, two schools of thought on the same thing. So that's something we need to be aware of, that there is competing evidence, and again, somebody had talked about that one study may not do it enough, one study will not change the world. That's what I was told. Henry, your PhD is all beautiful and nice, but it will not change policy in the way that you think it will. So again, you need to accumulate evidence, you need to get like-minded researchers, you need to, in fact, I remember we were told, what kind of evidence are you presenting before us? What's the quality of the evidence? Because people, they'll try and pinch holes in your study. You'll pick on your methodology, did you have controls? Did you selection bias? So as a researcher, you have to know that you'll be challenged, and sometimes some of the research we do is contrary to the interests of the stakeholders of the day, industry interests, manufacturer interests, So these people always also hire their own researchers, or they engage, or they provide contrary evidence, They can. So no, it's not true that smoking leads to lung cancer. They always come up with, and they say, well, probably this study was done in the Lancet, in the New Journal of England Medicine, New Journal, So sometimes you think you have the best study, you have the results, which ideally should be adopted without a lot of debate, but you'll be surprised, all right? So that's something one needs to know. But maybe let me just give you something I learned from because I'm really a tobacco control advocate. And in Uganda in 2015, I was part of the team that was pushing for Uganda to adopt a tobacco control law in Uganda. We didn't have a tobacco control law in Uganda until 2015. But I remember, of course, we had the evidence that tobacco causes lung cancer in 76% of the cases, that leads to heart disease, that leads to throat cancer, the evidence was there. But I can tell you that wasn't enough to move members of parliament to see the point of having a law regulating tobacco in Uganda, So we even had to engage in civil society organizations, Sometimes you have to get ambassadors, program champions, the first lady of your country, So that's why I said, when you get into this space of knowledge translation, you may need to wear a different hat. You may need to be an advocate, an activist, And I know some scientists are not comfortable with that. I know that. Some say, but Henry, am I a scientist anymore? But if you really want to see social change, we for example, in tobacco control, we saw that once we got people of the medical association giving us letters of support, we got bishops, religious leaders coming on board. People listen to these kind of people, I remember even during COVID, they had to get a bishop to kind of encourage people to wash their hands, wear face masks, because our people, our policymakers, sometimes believe in those people more than they do believe scientists, So, and also, as I said, look for not only your own paper, your own evidence. Try and do research globally, okay? And we are told also to get evidence that is context specific, that is similar to African setting. If you're going to get a study, don't get one from Britain, from Spain, from Italy. Ideally, get to study from Nigeria, from Malawi, from Zimbabwe. So ideally, if you're making a case and you're trying to say my study is also agrees with another study, ideally get studies that are context specific to sub-Saharan Africa. You know. So also I need to mention that policy change or engagement is a protracted process. It takes a lot of time. It may take years even to get what you want to do. You may get your study done, like some of you may have done your PhD 4 years ago, and what they're doing now is what you had advocated for 4 years ago and did your PhD. For example, I can tell you that my supervisor did a PhD where he was advocating for what they call results-based financing, where they said instead of these uniform budgets, the government should give money to health facilities based on their performance, based on their number of people who are being tested for HIV, number of people who are being enrolled on ART, number of people who are getting tested for viral done, and instead of this what is called budgets which are carried off from the previous financial year, he suggested that we should actually do performance-based budgeting. Now, I can tell you he did his PhD 10 years ago, but this policy was passed, I think it was last year, you see? So I think you have to be patient if you really want to see policy change, because it takes time, you know, because there are many people who are involved in policy. For example, in tobacco control, I can tell you that I remember in Nigeria, the parliament passed the tobacco control law, and the president at the time did not even sign it into law because there were many industry interests, you know, and they had to wait for that president to leave office for Nigeria to sign that tobacco control into law. So you can see. So imagine you have been pushing through the district, through the community, through the industry, through the consumers. You have gone to parliament, the law has been passed. And now it has gone to the president for his signature, for his consent, and he doesn't sign it, you know, and you wait for him to be succeeded in office. So I think you have to be dynamic, and I think you have to leave your comfort zone as a researcher. This cocoon of being in an ivory tower, thinking because you are published in the Lancet, everybody should quickly absorb what you are doing. And I mean, the world is very complex. There are many interests, there are many processes, there are many stakeholders. You know, in health policy, we call it a complex adaptive system. You know, there are no linear, like in 6 months, they're going to pass your policy. No, it can keep going around. I'll give an example. In Uganda, we passed although Kenya now has a national health insurance, I think, policy. In Uganda, we passed the national health insurance policy by parliament just last year. And of course, we are advocates. We wanted the government to take over this mantle of healthcare to ensure everyone, to avoid this catastrophic health expenditure, you know, and people should contribute through their employment, the informal sector, to this funds so that the government can provide healthcare to everybody, regardless of financial ability to pay. And this bill went to the President of the Republic of Uganda. The president did not sign this bill. And I think some people think it's a progressive man, but he sent it back to parliament, you see? So you can see people, some of us who are engaged in this bill to pass the Ugandan national health insurance policy, we had our hopes dashed because we worked very hard through parliament, we worked with the civil society organizations, we worked with the patient groups, you know, we worked with the local government, and went to parliament, worked with the Committee on Health in Parliament. Then the whole plenary of the parliament passed this bill and said, okay, we recommend that this is passed into law, that Uganda passes the national health insurance bill. Now, procedurally, this has now to go to the president to sign it. And the president of Uganda said, no, I'm not going to sign this bill. You know, so you have to have a thick skin, you have to be resilient, you have to endure, you have to be persistent. And also you have to be, I think, as I said, you have to be dynamic. Don't work alone. You cannot change policy by working as a researcher alone. No. Work with like-minded people. For example, in tobacco control, we work with people from Johns Hopkins University, work from an American NGO called Tobacco Control Free Kids. I mean, with many, even CSOs, they even give us legal support to deal with even legal bills from the BAT, the industry, sued Uganda for passing this law. And we got legal support from these people. So you have to even work with the allies, you know, so don't work alone. And let me tell you, if you have a good cause, there is always support. I can assure you, there's always support internally in Uganda or in Kenya, Nigeria, or globally to help you, all right? But be prepared to work for the long haul. Don't expect quick results. Dig in, you know, for the long haul, and eventually what you want, the social change you want, the increase in taxes, the change in treatment guidelines, whatever you want, will actually eventually, if you really see it through, will happen. So there is no magic bullet, Evelyn, I think, in my experience. You know, yeah, you have to be resilient and creative. Thank you.
Okay, great. I think you've talked about a couple of things: contrary evidence, you know, creating champions. I may come back to you or to any of the panelists to talk about that issue of, do scientists have to become the policy engagement champions, or should we recruit and hire specialists in policy engagement who can help us translate, package, and synthesize our work? I think there are two areas and then two schools of thought in this area. So that's a question I want to park. But I wanted to perhaps ask Gloria a question in relation to a question that's been asked by Kikelemo. How do you convince political leadership of the worthiness of research cause from the start when no policy window seems already open? So Gloria, the area around aging is one that may not have had a political interest, political discourse. You've been working in this area now for a couple of years, but there was no political window open, I think, across the continent saying we need to come up with an aging policy. So what are your thoughts around pushing your agenda irrespective of the fact that there's no political window at that time? There are no, like now climate change is hot. Of course, we know there are other issues around, what's the other hot thing? Of course, vaccines and misinformation. All these things are hot because it's in the political window, so we could capture on that. But you worked in aging when no one cared. I don't want to say it, but it's true, no one cared. So how do you go around doing something about that?
Yeah, I mean, you're very right, no one cared, and even up to now, nobody still cares. It's been quite a steep hill to climb to try and convince anybody to take an interest in aging, particularly policymakers. So I think our trick or our strategy has been to approach it from thematic areas rather than just talking about aging. Because if you talk about aging, the default fallback would always be, we are not like Europe or Japan, where the population is almost half are over the age of 40. We still have a young population. The youth is our concern. So our strategy has been to use thematic areas. So one area that we've focused on a lot is just issues around poverty, issues around lifting people out of poverty. So and we say that majority of, or compared to young people, actually, most older people are below the poverty line because they are out of the job market, they are no longer working. So this is an area that we should focus on. So identifying a theme or identifying a theme has been our strategy rather than talking about aging, and has been our strategy of getting people to listen to us about aging. And the other strategy has also been to use really personal experience. So we normally try and not create a guilt, but just ask people about their personal experience, how would they want to live when they are older, because this is a journey that everybody has to go through. How do you want to see yourself 10 years from now? How do you want to see your children when they grow older? Or how do you want to see the society when they grow older? How do you show the value of your society when you're not taking care of the people who are weak and vulnerable? So we use sort of a guilt trip in a way to convince policymakers to see this as something that is worthy of focusing. And it takes time. And I think just as Henry has said, you just have to be persistent. You have to be constantly relaying the message, looking for different champions. Henry has also mentioned issues around champion, looking for different champions so that you have a bigger voice in convincing in sort of convincing that this is an area that should be addressed across policy. And we've had countries even that are still demographically way behind compared to Kenya's a country like Rwanda. So using that as an example, in Rwanda, this and this is happening, even though their country is still quite youthful compared to even South Africa or Kenya or other countries in Africa, but they're already beginning now to address issues around aging because they understand the importance. So this has been our strategy, and it's something that we are still championing and trying to have a lot more people on board. And the one thing we've also tried to, the other approach that we've tried to use is to have a sort of a multi-sectoral engagement. So not just approaching aging from the health perspective, also thinking about aging from the social perspective. So bringing in organizations and maybe ministries working on social issues and social protection, also issues around housing, issues around transport, just trying to show that this is an issue that cuts across so many different sectors in society. So trying to think of it in a more broad sense has been quite helpful in convincing policymakers.
Okay, thank you.
So I just wanted to...
Yeah, go ahead, Gloria, go ahead.
Yeah, just to respond to a question from Samuel Maniki about conflict and friendliness or hostility from policymakers. From my experience, I think I've had just a couple of incidents where you've come with researchers from outside the country, where the policymakers now become hostile because they feel that we have outsiders coming to dictate to us what to do. And that was quite a difficult moment, but I think what the next strategy that we used was now to identify key people in the ministry who became our spokespeople, and rather than having, so that they don't have the feeling that this issue is being driven by outside forces. We want something that is organic, that is sort of homegrown. We don't want to be dictated to by outsiders. So that was one experience that I thought was quite just one experience that where we had very unfriendly or hostile environment with the policy. Thank you.
Thanks, Gloria. I think even Florence in the chat has mentioned that local context is important to some policymakers, and that's where we can definitely shine. I think one of the things you brought out, which is something that maybe perhaps we ought to think about and be better at linking things, the multi-sectoral approach, but even the thematic approach. You know, as you were speaking, we know, I think it was Henry or it was John who brought out the issue that the National Health Insurance Fund in most countries is a hot topic. Yet, and we also know if you go to the private insurance, they'll tell you, you know, we don't take old people onto our policies anymore because they're expensive. So we can always argue that if we don't do research around aging, for example, in relation to this very hot topic around insurance, we wouldn't be able to understand how best to prevent the national insurance funds, for example, from being overburdened by issues that are primarily being led by the aging population. I think points that you've made, the demographic dividend, we always think about the young, but now we're thankfully an African nation that is living a bit longer, so our life expectancy is longer. So, you know, waiting for policy windows to say, okay, now it's time for aging may not actually address issues around how do we address an aging population that needs the help that they need because we are surviving longer. So there are those multi-sectoral perspectives that we need to keep playing and engaging with, or working with different partners, housing, etc. And not waiting, but looking and saying, these are the new priorities for the ministry. This is how we can plug in from our perspective in aging. And that brings me to another point of the policy window. Perhaps one thing we ought to think about, and John, as I bring you in to maybe address one or two areas, is how do we influence the policy arena, when they're setting the agenda, who is communicating to the policymakers what should be a priority? Is it them because of the noise of their voters, for example, if we're talking about parliamentarians? What is the role of the scientists? You know, I think Kenya's health ministry will be going to an agenda setting in June, July. How do we address those issues? How do we get to that point where we are saying, look, this is the evidence. We've done all these scoping reviews. Please, please, please consider point 1, 2, 3, and 4. John, how do we use evidence to help countries set priorities? Because that's what we're talking about, opening the policy windows. We need to open them up. Thank you. Over.
Okay, thank you very much. You know, if we don't take a step, nobody will take that step for us. You know, after the joy of having research is that research outcome to be used. And the researchers, I saw a question, I will start with that question also, that should researchers also be trained in the area of policy engagement? Yes, researchers need to be aware. And that's the reason why in any organization, universities, research organization, they do have communication department also, or units that will work in hand with the research. Hello? Hello, are you still with me? Sorry.
Yeah, we're losing you a bit, but we're with you.
In communicating the outcome of their work. You know, in view of this, if the ideas or the outcome you've got is not a kind of a concern of the government, maybe it's not visible, researchers or the research organizations or the university, we have the right, we have the capacity also, or we have the responsibility to make sure that ideas we want to bring out is being heard by the policymakers. I'll give you an example. When I did my re-entry grant from CARTA, I was doing something on looking at Nollywood movies, how the communication or the message from Nollywood movie promoting or discouraging young people from going to sexual risky behavior. During that period, I made use of the Nollywood, the filmmakers. You know, from the beginning, I had a meeting, I called them, we had a meeting that this is what I want to do. And these people, they are the influencers. They are there, they are well known, they are popular. So after doing this, they were able to take my message beyond the level that I have it. Because if I don't engage them, I may be spending it, even if I spend money, you know, in the newspaper and so on, that message may not be heard. And it will not create a kind of interest in our policymakers. So we have many ways whereby we can create that interest. We can wake the interest of the policymakers in whatever we do. For example, another one, which is in Nigeria, we use that during COVID-19. They made use of the influencers, you know, like the musicians, the ministries of people, the actors and so on, to promote issue of COVID-19. Wash your hands, social distance and so on. And from time to time, they made billboard, which is traditional media. Apart from billboard, on social media from time to time, they show short videos of these people. That is one. Another way in creating atmosphere that your ideas or your policy, your outcome is seen in the public also is like in Nigeria, they make use of the wife of the governors, for example. I will give example of my county, my state where I stay now. For example, when the lady came in, the people that are advocating about the issue of HIV and AIDS make sure that she has an office, a project, you know, in promoting safe sex, in promoting use of condom and so on. It's an office of the wife of the governor. So you can see how that would be, because the noise will be there, you know. So when they're talking about the issue about this in the government, it won't be like a new issue, because we've gone to the heart of that governor by using the wife to promote the issue about, the issue at hand. So what I'm saying is that we have a lot of ways using the policymakers, using the spouses of policymakers, using the influencers, whether the offline influencers or online influencers, there are many. You can use them to make them ambassador and make sure that they promote the ideas you want to promote. Not only that, there's another area where we can promote this issue. For example, that you can keep writing about this, especially using social media, having hashtag, speaking about this idea from time to time. Naturally, when you lay emphasis on this idea, naturally it will be hard, and the policymakers will not have any choice but to listen to you. So, and another thing is the issue of writing, blogging, trying to create an atmosphere. You can even do what's called optimization. For example, now after writing, you can find a way of make some payments that they will make your ideas or your message to be in the forefront of anything. Or maybe your target is young people, for example, secondary school students. When you optimize, they take your message to their domain, to their doorstep. Whenever they click anything online, they see it. You can create billboards on campus. You can even have ambassadors, as Henry mentioned, in schools to promote your ideas. For example, now the issue of this Nollywood, when I did it, I made sure that the school authority are aware, and we have champions that are encouraging young people not to watch movies that will lead them to go into risky sexual behaviors. So these are the ways, using the policymakers' relatives, using the influencers, like the actors, the singers, allow them to be able to key into your ideas. And apart from that, you can also use like movies. You can use blog about this thing from time to time. All this we create a kind of it will create a means for you to be known and your ideas to be known, if you do that. So I will stop here on this point. Thank you.
Okay, thanks. I'm seeing you've given some really good ideas, and I can see a couple more coming in. For example, Florence says student clubs can discuss a topic per week. The human rights approaches create healthy food environments is one way that they have done. I think there are a couple of areas that, as you were speaking, I was saying, one of the challenges we have, especially with the policy window, is the fact that because of the research cycle, we may have research has been done, it was funded, it was not relevant to policymakers at that point, so we put it on the shelf. Is there a way, and I'm speaking to you, John, as a librarian, and then maybe we can open up to others who may think about how to keep actively engaging. So let's take Evelyn as an example. She did some research 10, 15 years ago, and then she left research. But that research was relevant, or is now relevant in today's world. Is there a role for institutions to keep going back to the knowledge they've generated, and how do they do that? How do they keep thinking about evidence? How do they manage their evidence so that when the policy window opens, things work out? It would be really important for us to think about these things. John, do you have maybe a very brief answer around knowledge management that allows for us to keep reflecting on what has been done over time? And also the issue around, I think one of the questions we said was, sometimes you go and you're told that has already been done. The issue around duplication. How do we manage knowledge so that we're not duplicating, but more importantly, so that we're actually also keeping our evidence for that window, not necessarily as an individual, but as an institution?
Thank you very much. Knowledge management is very, very important, so that, we will not keep repeating what has been done before. And that's one of the reasons why we have libraries and research libraries around the world. For example, even university library, we do keep records of what has been done, and with the advent of technology, internet now, you don't need to even travel to. Are you still with me? You don't need to travel to Ibadan before you know what work has been done. We have what is called institutional repository that all universities, all research institutes now do have, whereby all the work that has been done in these countries or in these schools, about the country or done by the citizens of that country in another country are being put in the repository. And this repository, they are democratic in the sense that it's available all over the world. For example, now, if you want to know the work done in the University of Ibadan, if you go to the online, to the library, there's a repository there where you can see the list of the work that has been done. At times, they provide even the abstracts of this work. Some universities even give the full work. For example, in Nairobi University, my work that I did there was available. I can just give the link to anybody to check. And from time to time, also, they provide a list of the areas, the topics that has been worked on. So if all universities are encouraged to go into digital repository, it will help a lot in repeating or duplicating what has been done. And you all know that even after the work has been done, at the back, at the summary, you have for further studies. Even we do send our students online to go and see what they have been done. What is the gap? What can you do more? And even CARTA has been supportive in doing this. I know there was a time that CARTA supported all the universities, all the institutions under CARTA, where we form a kind of repository of the research done in those countries. So with the help of the digital repository that is available now online, it prevents duplication of work, and also it gives room to see further studies, the gap, and some other things. Thank you very much.
Thank you. I'm smiling because the chat is, and thank you, John. I think I just wanted to make sure we always keep in mind that we need to manage knowledge, but also keep it alive. But the chat is amusing in that we're talking about governors' wives, but actually, aside from the amusing part about governors' wives and how we can capitalize on them, it's the point around decision makers. So we've been talking about policymakers, but actually the point that JPR has brought out is that, some government decisions are not necessarily made by those who we assume are going to make those decisions, but decision makers may not necessarily be the policymakers that we are approaching. So a point in discussion around when, who, where, what, how do we find them? How do I identify them? Violet, you talked about, the youth that you're engaging in, but actually the people who are going to make decisions on the policies you're going to make may not necessarily be even the policymakers that you are talking to. There are others. The church, for example, may be very influential in how these policies are made. So at what point do you start engaging the other decision makers, not necessarily the policy makers? Violet, do you have a thought on that?
Can I just say something small?
Go ahead.
No, I just wanted to just say something very brief, and then Violet can come in. Is that I think we now know that there are different kinds of decision makers and the different kinds of power. I'm told that you can have formal power as the district chairperson, the county governor, but that people also have who have power, who don't necessarily hold positions, who are also very influential, even more influential than those who hold power. So I think we need to distinguish, because when we are thinking around this matter, we should know that sometimes people who make the decisions or who are very influential are not necessarily those people in positions of power, or those who have formal positions, chairman or district governor. Sometimes you may find somebody who is a power broker who is outside the formal structure of the bureaucracy, who's actually even more powerful than the whole, some people, like a district chairman, and you listen to one kingmaker, for example, and whatever he says, you listen to them. So that's one thing I wanted to share with you, that I think from my training, I was told that there's power with those with formal positions, but also there are people who hold power who are not necessarily in the formal positions or in the bureaucracy as we know it. There are some people who have power behind the scenes. And I think as a policy, as a person who wants to influence policy, you need to take time to do like a quick scan of the environment. There are people who call it political economy analysis, to understand where power is held. It may not necessarily be in the formal organization. It may actually be outside the formal organization, and I think you have seen this in political parties, but you have had in Kenya, I've had people, Ruto, saying that somebody is being fronted by some people in Kenya, so one has to know, I think, to do just a scan of the environment, to know where you are trying to intervene into, where is the power, who holds the power, it may be beyond just the formal structure. Yeah, but Violet, please go right ahead.
I think you've just covered it all, really. But I just want to emphasize something that was even mentioned on the chat by JPR. We have to think about influence and interest. When we talk about influence, pillow talk matters. It's very well known. Some first ladies are extremely powerful. In fact, sometimes they will say, oh, you have something about adolescent health and family planning. Have you talked to the first lady? What does she think about it? What is her stand on it? What about someone as John is sharing about religious leaders? What's their stand on that? And some religious leaders are very powerful in some of the counties where we come from. And if that's where you're focusing your intervention and your interests, knowing actually when we teach about policy and policy engagement, there's a session where we talk about drawing a matrix of influence and interest. I forget what was that thing. And the idea is that you literally group these people you're trying to get to into this one is in my pocket. We already, the interest is there, the influence is there. And I met them last week in church. This one, I really need this policymaker. They're completely not aligned, and they'll be away for 2 months. I hear they're going to the US on a tour. So you plan. And like Henry taught us, you think about your particular audience all the way to an individual and what the message you want to take them in. So see, someone like a governor is so important, but they have very little time. So you really need to package something sweet and short and very specific, the elevator type, speech type of thing. If it's the governor's wife, I've seen a good example, have a prayer breakfast, because those are things she does. Like some of the first ladies I've seen in our country have something they want to be involved in. It could be a charity around orphans and vulnerable children. So, or they could be interested maybe in geriatrics or something. So if that person was there and you're doing the work on aging or something like that, that's someone you would use that type of their already existing interest to encourage them to be part and parcel of what you want to do. But I think the primary thing, honestly, and I really believe in this, if our science is sound, if we are confident about the data we are collecting, we can stand up and confidently say, this was the problem. And this is what I have found out. And this is what I think can be done. And if we take time, as Henry was summarizing, to map out who your audience should be for what aspects of those findings in particular, because of course, a project always comes up with so many ideas. You can have, God knows, 10 policy briefs coming out of one project. So be very specific and come down and break it down to that granular level and decide how you're going to roll it out. And always remember to budget for it. I think we often forget and underestimate how much it's going to cost. But I think now bringing in the bioethics, if we think it matters, if we think the sponsor who gave you that money, the money, you should feel obliged to make sure that Mary, that mwananchi, as Henry said, oh, Henry knows a lot of Swahili, that mwananchi is served through your project because you did it right. Have a budget and make time to engage these stakeholders to do a lot of dissemination and find out even what they think about that work. And it will be much easier to ask them to take it up.
Thank you, Violet, for those points. I think you've raised, the issue of budget that keeps coming back to my mind. Are we trained well enough as researchers to budget appropriately for policy engagement? We also talk about implementation, and I think one of the things we budget for is dissemination, but we don't actually think about beyond the, hey, yeah, we published this paper, these are our results. We don't budget for the engagement that we need for the uptick. As many of you have pointed out, policy making is a long process and it takes time. Anything that takes time takes money. But many times the reason why we don't continue the continuous engagement needed to make the change we need is because we don't have the resources and the funding for that. Because of time, I'm gonna go around the panelists now and ask you to very quickly, in one or two phrases, what would be your take home in terms of what would be the key thing you would want a new researcher to think about in terms of policy engagement so that they can become effective researchers who engage with policymakers? What is the one thing? And I'll just go across the screen as I see it. I'll start with Violet, followed by Henry, Gloria, and then John. What is that one thing you would want researchers to know early in their career or could do better than you did before? Violet?
Thank you. And thank you again for having me on this CARTA forum. It's extremely important. It's been a pleasure. I think from my heart, what I would say, if it's a problem that is true to the people of the locality where you're doing the research, take the burden to take it beyond a publication that goes on the shelf. Look for additional funding. And interestingly enough, there are enough sponsors out there if we can convince them that what we are doing is for a humane reason and that we want to make a difference. So start with the thought that I'm going to make a difference. I'm going to be a responsible researcher, a researcher of integrity, and I want to make a difference. I think it starts with me as a researcher. You said 1 minute.
Henry? Effective short communication.
Okay, I think just one take-home message I would give to my fellow early career researchers is that policy making is a process. It takes a bit of time. It's not a linear process. It may be iterative, back and forth, all right? So be able to engage multiple stakeholders, multi-sectoral engagement. And if you really have sound data and you have the right data, be patient enough to see it through. Thank you.
Thank you. Gloria. You're on mute, Gloria.
Typical mistake. So the one thing I can add to what Henry and Violet have said is that researchers should not assume that the policymakers have no knowledge. I think increasingly we are seeing the policymakers, and even just the ordinary person has access to probably the same information that where you're drawing your information, they also have access to that source. So don't assume that they don't know or they're coming from a point of ignorance. So that would be my message. Thanks.
Thank you. The equal partnership, mutual understanding that we respect each other and we are knowledgeable equally. John?
Yeah, thank you very much. I will say that, the researchers should not see dissemination of your research as just what you can do maybe at the end of your research. Because dissemination, if you make research dissemination to be priority, part of that process of research, it's a process that cut across from the beginning to the end. You'll be able to engage communication, information and communication experts to work with you. When we're having your team, don't just say, oh, my work is on HIV and AIDS alone, is on this. I don't need communicators. I don't need information scientists. You need to invite them and let them work with you from the beginning. So they're going to give you the strategies, how you can disseminate, how you can get engaged, how you can get the policymakers engaged in whatever you are doing. So in research, you should not overlook the contribution of the communication and information experts. They will help you in communicating your work well. Thank you very much. And thanks, CARTA and APHRC for inviting me to this panel. Bye.
Thank you, John. I love that you finished to that point because I have been over the 2 hours trying to bring that conversation around the specialists, the information specialists, the community engagement specialists, and how much they can help us develop proper strategies. I'm glad that you finished with that. I must say, for me, it's been quite an interesting and exciting session. It's been 2 hours. I didn't even see how quickly that went through. I greatly appreciate the panelists. Gloria, for your insights into actually something that many of us don't think about, is engaging when we don't know or we don't have a political window. Henry, your insights around the different types of communication and engagement you need for the different participants and stakeholders. Prof. Violet, your passion for policy engagement always comes through, and you have so many nice snippets of how to do things. I could see people saying, "Oh, I need to talk to Violet about this. I need to engage." John, you bring us a very new, interesting perspective on not new, but actually how do you engage in the new media, in the old media, and then more importantly, how do you engage with specialists in information and big areas. The issue around budgeting, the issue around appropriate resources so that policy engagement actually gets achieved. It doesn't happen because it happens. It happens because we're intentional about it. So it's really important. And I really also want to close and thank those who've been with us, the attendance of the webinar. You've been with us for 2 hours. You've listened to us. The chat has been vibrant. You've been really, really engaging and have driven this conversation. So thank you for joining us, and thank you for coming and allowing our panelists to share with us their point of view. Lastly, the organizers of the webinar, thank you so much for having this session and running it seamlessly. Rita, Topista, and the entire CARTA Secretariat for organizing this and allowing myself and the panelists to be part of this exciting day. So I'm not gonna drag this on anymore. I think we will be able to get a bit of a report coming from here. Henry, you wanted to say something?
Not at all, not at all.
Okay, I saw your mic was open, so I want to close the webinar by saying, please remember that engaging policymakers, co-creating with them, bringing them from the beginning, looking for those opportunities, the windows, or making it happen by looking for the governor's wife who might be influential, looking for those champions is really important. And that policy engagement has to be intentional. It just doesn't happen because it happens. It happens because we as researchers are passionate and believe in our own evidence that we've generated. So thank you, and do have a lovely weekend. And we look forward to further engagement around this area and improving ourselves as researchers so that we can engage others. Do have a good evening.
Thank you very much.
Thank you.
Bye.
Bye, everyone.
Bye. Thank you very much, Evelyn.
Okay, thanks, Topista.